All right, so in this video, we're going to be going over the Dix-Hallpike. It's important to know that if you're doing the Dix-Hallpike test it is for BPPV, specifically for the ipsilateral posterior canal and then the contralateral anterior canal. It's going to be, so some things that lead you down this road. Number one is the symptom description. They're going to describe their world spinning or vertigo. It's going to be worsened by head movements. And as far as how long it lasts, the duration, it's going to be most often less than a minute, so around 20-30 seconds. And if it's more than 5 minutes, 4 to 5 minutes, then it's not BPPV because it is strictly a low duration that gets you to that point. Also, no red flags, so no upper motor or cerebellum sign or symptoms. And then whenever you do your gaze assessment, there should not be any spontaneous nystagmus. So that gets you to the point where you're thinking it's BPPV. Throughout the test, you're going to look at their eyes and watch for that positional nystagmus. And then what kind of nystagmus you see is going to be really important about what canal is affected. It's testing the ipsilateral posterior canal and contralateral anterior canal. Upbeating torsional nystagmus, so upbeating torsional, the fast phase is up. That is indicative of posterior canal involvement. Downbeating torsional is indicative of anterior canal. And then if it is purely horizontal, either way, then that would be indicative of the horizontal canal. But keep in mind the Dix-Hallpike is for posterior canal. So before we go through the test, you want to always educate your patient on what exactly you're doing. We're trying to actively make him dizzy and reproduce the dizziness. That way we can see the nystagmus. But it's important to know that if this is the kind of dizziness you have, we can fix it, okay? Good. So don't be alarmed, okay? But if this is what it is, and then we do the repositioning technique, you'll be good to go, okay? Always have a bucket ready, just because we know that dizziness and nausea often go hand in hand. And if they were to get sick, you want somewhere to catch it. That way you don't have to clean it up. And then sometimes there's a off feeling you can have after the technique, but you shouldn't have the same dizziness that you had before, okay? Okay. What I'll have you do is just sit here with your legs on the table facing that way. Good. So what we're going to do first is test Anthony's left ear. So ideally you want their head hanging off of the table. That way you can get them in enough extension. So you're going to have them put their head back, and then we're going to put the ear on this side. So we're testing the left posterior canal. So go ahead and just hug yourself. There we go. And I'm just going to have my hand here. So head extended, rotated to the left about 45 degrees. So here we go. I'm going to drop you back. Keep your eyes open. 1, 2, 3. So here we are. I got his head rotated. He's looking 45 degrees and he's looking at me. You would keep him in this position for around a minute. It is normal to have some latency or a few seconds where they're not dizzy at all. And then it can come on and you'll start to see the nystagmus if it's positive. And then a helpful tip is, if this was positive, what I could have him do just to see his eyes more clearly, if you don't have any goggles or anything like that, is I could have him look toward the ear that's down, and then I could see any torsional component a little bit easier, because then you can see his blood vessels. So let's say that was negative. So I'm just going to get him back up, give him a second, and then we'd go to the other side. All right. Now we're going to do your other side, so bring your head back and then rotate it about 45 degrees, okay? We're going to go back, okay? 1, 2, 3. So now I have his head here. Again, you're just watching the eyes. So now let's say that in this example, Anthony was positive, okay? And we see right posterior upbeating nystagmus. So that would be indicative of right BPPV, right posterior canal BPPV. So now what we're going to do, since we have a positive Dix-Hallpike on the right, we are going to we're going to do the Epley maneuver. So the first step, wait until their dizziness is gone away, and then you're going to rotate their head. After a minute of them being asymptomatic, you're going to rotate their head 90 degrees or 45 degrees to the other direction. Again, keeping an eye on their eyes. Once their dizziness stops for about a minute, you're going to then move to the next part. So what I'm going to have Anthony do, so keep your head here. What I want you to do is roll over onto your side, and I'm going to move your neck for you, okay?
Good.
Okay, go ahead and start rolling over. So then at this point, I'm going to move his head into flexion with his chin into his shoulder, okay? This one's another common one. So the test position for the Dix-Hallpike is normally really symptomatic. And then this position, the one we just did, is also pretty symptomatic for these people. So watch their eyes. Again, a minute after they are no longer dizzy, we're gonna move on to the next position. So go ahead and bring your legs off the side of the bed. Good. All right, I'm gonna help you sit up. Keep your chin on your shoulder here, okay, as we come up. Good. Something I like to do is kind of keep your arm here because you don't want them to rotate their head yet, okay? All right, you can have this arm come down to help you push up, okay? All right, 1, 2, 3, push up. Yep, keep your head there, good. Again, we'll stay here for another minute after he's done being dizzy. And then after that minute, you can look straight ahead, okay? But yeah, that just goes through the Dix-Hallpike, and then if it's positive and you see that upbeating torsional nystagmus going through the Epley's maneuver. Thanks, Ant.
Problem.